program, and go Rad. Today's program will include short presentations by myself, Megan Harris, Emily Kornheiser, Sarah Lunderville from Vermont Coalition for Disability Rights, James Haslam, who's the founder and director of RAD, three folks from Be a Hero, Tracy Crowder, Anna Maria Arquila, and Ady Barkan, and last, we know, Bernie, of course. And we're so grateful that he's going to be coming as well as all our other speakers. Yay! So I just wanted to mention that we made every effort, including I called every sign language interpreter within 100 miles of this event, and everybody was either busy previously or on vacation, so I apologize, there's no interpreter here. Today's event is a great example of RAD's commitment to building a statewide movement and it's wonderful that they speakers with a message of hope and outrage to small towns like ours and Bennington and all of the other small places in the state. It's not just you have to run up to Chittenden County or Montpelier for all of their events, and personally I'm extremely grateful for that. In these challenging and sometimes terrifying times, I expect we will all be re-energized and inspired to actively take back our country by today's speakers, and I, for one, can't wait to get started on that project. Thank you all again for being here.
Hello, thank you everyone for coming. I'm Emily Kornheiser. I'm running to represent Brattleboro, District 1. I've lived here for more than 20 years, and in that time I've learned about the power of working across issues. And we'll hear so much more about that today, about how we can't think about healthcare as separate from economic justice. We can't think of the environment as separate from healthcare, and we can't think of any of these issues without thinking about the people who are most affected by them and being led by those people. That is why I'm a member of Rights and Democracy. But the other reason I'm a member of Rights and Democracy is because someone asked me to be. I want you to each remember that today when you walk out this door, that someone had to take the time to stop and ask me to become a member and to join this movement. I was working here locally, organizing activists. After the election, we were coming much closer together to again see how entwined all of our causes were, to speak across difference and tactic. And when we started the Windham County Action Network and had our first spring into action, someone from Rights and Democracy, come, please. Our regions in our state, about what it means here to work across difference, about the tactics that you used to bring people together, that we used here. We need to continue to do that. We need a statewide movement. We can't just have movements in our communities. We need to learn from each other across the state. We need to learn from each other in order to reframe issues in our state house and on our dirt roads. We need to learn together so that we can build a statewide movement that can be a shining star for a national movement and for a global movement of economic, health, and environmental justice. And we can't do it alone. That's why we have Rights and Democracy here today for really our first big event in Brattleboro. We've been doing some great organizing around the state, great organizing up north, and for a long time we felt that here in southeast Vermont, where we are so good at our causes, where we're so fabulous at organizing with each other, at showing up to rallies, at showing up to our weekly meetings, at pulling out our picket signs, and at knocking on each other's doors. But we need this coming together, and we need this to learn from other regions in our state and to teach other regions in our state. Because so much of the work, whether that's lawmaking or what happens in our communities with each other, needs to speak across that difference. It needs to have deep solidarity. And it needs to take the next step so that everyone can understand how deeply our lives are tied up in each other, how deeply our destinies are tied up in each other. And we do that by being started grounded at our base, and that's what Rights and Democracy does. It grounds us in the base of our movement so we can step forward into electoral politics. We need your help today. I'm here to ask you to please join Rights and Democracy so we can continue to fight for living wages, organize around elections, be at the State House, offer trainings to each of you, do policy research, and most importantly, make a commitment to communicating with you about the causes that matter to you. This movement right here is the real deal. This is the difference that we're going to make together. When we step up today, asking you please to join. And you can join by donating with your dollars, but you can also join by donating with your time. So when you walk out today, please, right across from the concession stand, you can fill out a membership form. And then again, walk into the street and ask one more person to join you, because that is how we build a movement. It's by listening here today, by understanding how these causes affect each of our lives, and then walking out and asking one more person to join you. Thank you.
How's everyone doing? My name is Megan Harris, and I'm actually from Saxon River. Thanks, guys. I had a lot to think about when I was deciding which healthcare story to share. I am the daughter of a Vietnam War veteran who served when he was 17 and returned home after being exposed to Agent Orange to develop diabetes and serious drug and alcohol abuse to deal with his post-traumatic stress disorder. So really my healthcare story started before I was even born. The crisis that we have on our hands and the work that we need to do to fix it, it started way before I was even thought of. I think that American privilege means that you're lucky, that even when you are lucky enough to have health insurance, sometimes the medication they give you to treat one condition causes a completely different condition you didn't know that you could have developed. So that's at least what happened to my brother. Last month I got a call from my mom. She said, I'm not going to sugarcoat it. Your brother has a blockage in his heart, and it's probably from all the years of being medicated for his bipolar disorder. I said, well, that'll be covered, won't it? I could hear her face fall through the phone. No, she said, it'll be considered a pre-existing condition, so we can't even get a waiver for it at this point. My older brother's only 29. A week later, I get a call. It's mom again, and this time it's my youngest brother. He suffers from audio processing disorders as well as violent mood swings and crippling depression. He's been homeless off and on for the better part of a year. He hasn't been to a psychiatric appointment, and he is unmedicated. They called last week to push back his Medicare intake evaluation. Can you imagine if you called the suicide hotline and you were put on hold? That's what the American system has become. I got a message from my friend, a good friend, a high school friend, 27 years old. She's in pain. The seizures have gotten worse. She had been living in the shadows for years with epilepsy, unbeknownst to most of us. The seizures have gotten worse, the treatments have helped less, and at the end of the month, the insurance sends her a $400 bill. She cries, knowing that it'll go to collections again. As I listen to another friend, a former colleague, she outlines the difficulties she faced growing up, caring for her mother with MS, only to reveal a few moments later that she has the symptoms of MS as well, only 5 years after she's given birth to her first daughter, same as her mother. All across the state, families they're being left behind. And they're being left behind for the sake of greed and in the interest of profit. our system has put a dollar amount on the lives of families who are, in most cases, one financial crisis, one medical emergency away from bankruptcy. Instead of leading the world as a top provider of quality health insurance that's accessible and affordable, we have fallen behind the rest of the modern world. We've put the interests of the for-profit hospitals and pharmaceutical companies in front of the American people, and we've left the most vulnerable amongst us to fend for themselves. But I will say that I do feel a change. Across the country, people are demanding that we move to a single-payer system, that our health coverage demanding that our health insurance is no longer tied to our employment or our spouse's employment, our parents' status. Just 2 years ago, a lot of us were called dreamers for thinking that people would come to a candidate, come to a movement that talked about spending a lot of money on a lot of health care. And I am so happy to say that just 2 years later, our vision is being adopted by one of the major parties in our country. And I think that's a real win. I think that we're seeing our vision spread, and I think that even so, our progress does not and cannot stop. And we have to start electing legislators who truly believe in a healthcare for all system, where we do not have to fight just to have basic dignity in our care. Hopefully you are all aware that there's an election this Tuesday coming up. Yes? A little more enthusiasm. So I hope you will all join me in coming out to vote during the primary election on Tuesday. If you have any trouble finding out where you vote, you want more information about the candidates, want to come help out with any of the candidates, please find me at the end of the rally. I'm happy to connect you, but we need you to help us fight for those legislators who are going to get the work done for us and get this thing passed. So thanks so much for all being here today.
Hi, I'm Sarah Lauderville with the Vermont Coalition for Disability Rights. This year marks the 28th anniversary of the Americans with Disabilities Act. Each year we take time to celebrate that landmark legislation. We celebrate the law that gave us the promise of inclusion, access to life, and our civil rights. As we look around the community today, we can literally see how that impacted our world. Better access to employment, shopping, transportation, housing, and recreation. On this anniversary, I reflect personally on my journey and why that was important to me. And I hope that everyone takes a moment to do the same, and not only reflect, but to share your stories. When I joined the movement, I was still embarrassed to talk about my psychiatric disability. The fact that I was on disability benefits, kicked out of college because of my diagnosis, fired from my job as a teacher because of my diagnosis, and locked up for a very long time in hospital systems. Over time, I shared those experiences and found hope and comfort with my peers in disability rights. And I am so proud to be part of the independent living movement, which accepts me and others for who we are and embraces our differences. We use those experiences and join in solidarity together with allies to continue to push for the promise of the ADA. But the law itself can only do so much. We all know that our society still has biases and still discriminates against people with disabilities. In the 21 years I have been part of the independent living movement, I have seen our celebrations of hope turn into fighting back to protect our civil rights. Over the past year, the lives of people with disabilities have been on the line more than ever, and we've done some serious work to fight back. Some of this work is legislative, fighting back against awful health care proposals that seek to eliminate those with disabilities from the picture altogether. To uphold the integration mandate of the Americans with Disabilities Act, we must pass the Disability Integration Act. The DIA helps fulfill the promise of true integration and finally addresses the institutional bias, ensuring that those who depend on long-term supports and services have what they need to live outside a nursing home or other institutions, and instead in their own homes, surrounded by people they choose and doing the activities that they want. We must fight against the ADA Education and Reform Act, which will strip back the rights of people with disabilities to file a complaint of discrimination against a business. The business community is fighting hard to ensure this change. We must fight harder. This change can open the door to other civil rights laws being challenged as well. It moved further along this year than ever before, and it only stopped, thankfully, because of some senators. But it's too risky. We must fight harder. This is the time to fight back and join with the disability rights activists from around the country. It can be done within the political structure or within our social structure. We still hear and see discrimination. When we see stairs on a building instead of a zero-step entrance, and it limits the places that we can experience. When employers don't hire someone because of their disability or because they don't understand how to accommodate someone. When we seek financial support in a systematic way that makes us feel worthless and powerless. When a person with a disability is sexually assaulted and the examination room is still not accessible. When a deaf woman is giving birth to her first child without an American Sign Language interpreter present. And when people with psychiatric and developmental disabilities are used as pawns in the fight against gun violence, even though studies show that those with psych and developmental disabilities are more likely to have harm perpetrated on us. When parental rights are stripped away. When parental rights are stripped away from parents with disabilities simply because of their disability, which is still legal in most states. And when the social narrative is ableist and assumes that having a disability is a life not worth living. We see these phrases of inspiration porn on Facebook every day, the catchphrases that make non-disabled people feel better about themselves and pity people with disabilities. We are disabled and proud. That pride is embedded in the ADA. It is embedded in the intent of the ADA. That no longer will people with disabilities be hid away, but instead out and living. This is the promise of the ADA, and this is what we are fighting for. I choose to continue to celebrate this legislation that has hope, inclusion, and equity all baked in, and change the paradigm globally for individuals with disabilities. And in that celebration, we reflect. We tell the stories of the past and strengthen our bond in one another. We find allies in that movement. We forge new relationships and recommit to one another. Thank you for your leadership as we work to end the discrimination of people with disabilities, stopping the cultural bias that infantilizes those with disabilities, and creating a world true of equity and true of promise. Justin Dart was a leader in ensuring the ADA was passed, and always reminded us all that we were all leaders, and he would say, lead on. We all must lead on in order to change this world. Thank you for your support, and I look forward to working with you as we all continue to lead on. To introduce a person I've had the pleasure of working with and leading with over the last, I don't know how many years, the Executive Director of Rights and Democracy, James Haslam. Thanks for coming.
Good morning, everybody. It's great to be here with all of you. This is the first stop on a big tour that Rights and Democracy is doing, and it's wonderful to be starting it here in Brattleboro at this one of the most gorgeous places to have an event in the great state of Vermont. So thank you all for being able to come out on a Friday to join us today. We have been thankful so much for the Latchis for having us, for Nancy, for Emily, for Megan, and all of our local Rights and Democracy volunteers to help pull this event together, and all of the folks from around the state and our staff that have come together here to make this happen. You know, as has been said, you know, Rights and Democracy really does believe that, you know, the movement that we need to build to address the healthcare crisis that we heard from Megan and we heard from Sarah, it needs to be deeply rooted in our local communities, but it also needs to be connected to statewide strategic people power movements and connected nationally. You know, part of the origin story as Rights and Democracy, as I know some of you know, was the struggle for universal health care here in Vermont. You know, as we know, Vermont became very close to having the first single-payer healthcare system in this country. And we did a lot of great work. That has been a movement that has started for decades. The Healthcare is a Human Right campaign that I was part of with the Vermont Workers Center, that was started in 2008, made huge strides in terms of changing what was politically possible in the state. Indicting the healthcare crisis as something that needed to be addressed and had to be addressed. One of the lessons that I took away when that law was abandoned by the political leadership in the state was that we needed to do more. You know, we at Rights and Democracy, you know, think of human rights as power struggles for justice. No one gives us the right to health care or the right to education, the right to vote. None of these things were ever just given to us by benevolent folks that were making the rules. People took the streets, people demanded them. They demanded them in the ballot box. Sometimes they had to get arrested and even killed to win many of the rights that we now enjoy. And healthcare is no different. And so when we realized that we didn't implement a healthcare system, it was basically telling us that we didn't have enough power to be able to win it. And we needed to, you know, be able to have more tools in our toolbox to be able to win it. And that our struggle absolutely had to be more linked up with national movements to be able to win it as part of finally getting our country to join the rest of the industrial world and having universal health care for every single one of us. So, you know, one of the big pieces of Rights and Democracy is we need to be deeply organized in our communities. And, you know, as a 3-year-old organization now, we've gotten very strong in certain areas and are still growing in other areas and are just getting started in some areas. So it's super exciting to be down in Windham County, one of my favorite places in Vermont. You know, just such great people, such great values that have been on display locally and it's you know, across the state for so long. You know, we are very excited to work with every individual and every organization about getting serious about winning. You know, we think that folks on our side that believe in policies that represent the values have to get much more serious about power. The people who we're up against are very serious about it. You know, the Koch brothers and those folks that right now are trying everything that they can do to dismantle democracy, to make voting you know, harder to reach, to make people apathetic and pit people against each other. You know, they don't have any qualms about getting serious about trying to win power, to wield power. And you know, as we know, right now we're in a very dark place because of that. We think that Vermont has a very good reputation around the country as being a very progressive place, but we have a whole lot of work to do. We have a lot of work to do on economic justice, on racial justice, on immigrant rights, on healthcare justice. You know, you name it, we have a lot of work to do. So it's just you know, a huge pleasure to be here, to be able to build this movement with all of you. You know, as has been said, we are a membership organization. We have people join the organization to be part of the statewide organization and also locally. And we're part of national networks because we're trying to figure out, Vermont has a role to play. Obviously, we can't change the country by ourselves, but there's a role for us to play. And we want to make sure we play it strategically as much as we can with our partners. We were very excited when we got going in Vermont that folks in New Hampshire wanted to join us. So Right to Democracy quickly became a bi-state organization. There's folks here from the Monadnock region in New Hampshire that have created a very strong local organization over there, Monadnock Progressive Alliance. It's affiliated with Right to Democracy. So if anyone's here from Monadnock Progressive Alliance, thank you for coming and thank you for all your hard work. And we are very excited to be part of a number of national networks that are figuring out how we can strategically in Vermont and New Hampshire help transform this country, help build a movement for healthcare justice, for economic justice, environmental justice, racial justice, immigrant justice. And we're super excited to be part of our revolution, which was inspired by Senator Sanders. You folks were able to go across to Keene about a month ago when Senator Nina Turner came on a Right to Democracy Power Building tour that was just like this, where we had huge crowds all over about building this movement, and we're very excited today to be doing it with one of our other partners, the Center for Popular Democracy Action, CPD Action, who are behind this Be a Hero tour, which has started over a month ago in California and has been going across the country to build the movement because they were part of the mobilization and lots of Rights and Democracy members that went down to DC after Trump got elected and the Republicans started coming after our healthcare programs. They helped mobilize members from all over the country, and dozens of Rights and Democracy members went down again and again and again to stop the repeal of the ACA, to stop the gutting of Medicaid and Medicare. They got arrested dozens of times to try to stop the GOP tax scam, which was going to mandate huge cuts to public health care programs and programs that so many millions of Americans depend on. And when some of those policies went through, like the tax scam, we had no other choice. We came down and told us stories, and you'll hear from the folks from the Be a Hero tour, including my friend and dear legend now in this country, Ady Barkan, who came down and gave them every chance. And now the only thing that we can do is vote these Republicans out across the country. So it is my great honor to introduce three of the leaders of this Be a Hero tour to come out and talk about this movement that we're building. Please give a warm welcome to Ady Barkan, Anna Maria Archilla, and Tracy Crowder.
Good afternoon. My name is Tracy Crowder. I'm the Racial Justice Campaign Director with Center for Popular Democracy Action. It has been my absolute honor to spend the last 6 weeks on the road with Ady Barkan and the Be a Hero tour. We started on June 30th in LA with a rally that affirmed and demanded that families belong together and out of cages. And at that time, I really reflected on the Angela Davis quote, which is that we have to act like we can radically transform the world, and we have to do it all the time. And so for me, that's what this tour has been about. It's about a radical transformation that we see people are hungry for all over the country. And so whether we're in a room in Reno, Nevada with veterans, or on a block party with our partner in Detroit, Michigan, we're talking about the same thing. We're talking about our shared humanity and dignity and the way we treat each other. And so it has just been such a pleasure to make sure that we are centering racial justice when we talk about the environment, when we talk about healthcare, and we talk about all of the things that we collectively want to see in our country, and making sure that not only are we talking about candidates, but we're talking about issues, because we know we're right and we know we're going to win. That you will follow along with the rest of our tour. We are in Vermont today, New Hampshire, and then we're ending in Maine. So beaherofund.com. You can grab some of our amazing t-shirts and swag, and also follow along with Ady's amazing message. And then I challenge you all to also be heroes and share your stories when you talk to your neighbors, because again, we're gonna win. Thank you. Co-executive directors of CPD Action.
Thank you, Tracy. Good afternoon, everyone. It's so amazing to be here in this incredible space after the very generous sharing of stories and vision of the people that spoke just before about the struggles that are theirs, uniquely theirs, and also so collectively shared about the healthcare system in our country. So I want to start by thanking those of you who shared the stories, thanking those of you who are here, and really thanking just bringing a message of gratitude to the members of Rights and Democracy that have really so fundamentally led the fight to defend healthcare in this country. Thank you so much. Ana Maria Archila, I'm one of the co-executive directors of the Center for Popular Democracy Action. We are a network of community organizations from across the country, 50+ community organizations in over 35 states and Puerto Rico. And we join together organizations like Rights and Democracy, of people who have chosen to step into their power, overcome their fear, and build together power that allows us to both imagine a new vision for our country and do the work necessary to fight for that vision. The organizations in our network are organizations that are fundamentally fighting to create a new America. An America where we can all be free. An America where we can all live. And we talk about our work as work that's fundamentally rooted in the sense that we must all have the basic things, the necessary things that allow us to live with dignity so that we can really, truly be close to living with freedom. That it is not enough to talk about equity if what we're saying is we're gonna be all equally screwed, right? What we want is to be equally free. So in this moment in time when so many people across the globe are displaced from their land, from their home, because the factory closes, because of war, because of climate change, because of inequality. We are fundamentally in this country and across the globe really fighting for the freedom to stay in the place we call home. Whether that means stay in the island of Puerto Rico after a devastating hurricane, stay in our town after the factory closes and there are no jobs, stay in our neighborhood or in our city as it is being gentrified, stay in our jobs, but we're also fighting for the freedom to move. Freedom to move in search of home, in search of safety, in search of community, in search of opportunity. The fight for healthcare is in some ways a fight for our freedom to move without losing these basic life-sustaining things that we need. Access to our healthcare, changing jobs and moving across state lines without losing healthcare. Medicare for all is precisely that. It is a new relationship with each other that will allow us to have the freedom to move without the fear of losing what we need, what is so dear to us, which is our healthcare, and so necessary. And we are fighting for our freedom to thrive. Anyone who has children in their lives, kids of their own, nieces, nephews, grandkids, knows, like, every time a child is born, you have this sense of possibility. Like, what can I do so that that child can be free and live her life to the fullest of her potential? What does she need? She needs schools, she needs healthcare, she needs her parents or the people who care for her to have jobs that allow them to have life that allow them to support their families and allow them time for joy and for play and for relaxation and for community. So the freedom to thrive is fundamentally the freedom to be able to live lives that are rich, that are full, that are joyful, that are dignified. So that's really the work that we're doing. We are living in this moment in a moment of tremendous darkness in our country. I think all of us understand that we probably never really imagined that we would have an administration that would be so shamelessly willing to essentially give as many of the public resources as possible to corporations and the rich. We just never imagined the shamelessness of the Donald Trump administration on that front. We never imagined the cruelty that an American president could display towards people who are coming to our borders in search of safety. We never imagined, I think, that we would be in a moment where the president would defend taking children from their parents as a way to terrorize them into not seeking safety for their families. We never imagined that. We are living in a moment of, in some ways, like great unveiling. What the crisis of children at the border did for the whole country is it lifted the veil on what immigration enforcement looks like. And it looks like what we saw. Children in cages, humans of all ages in cages, children begging to be reunited with one person, just one person they know, their parents, just one person. That's what immigration enforcement looks like. And that's just immigration. When we look around other issues, other aspects of our lives, we're seeing the same level of just total disregard for our ability to live without fear, to just live with a basic measure of safety. So, in a moment of so much darkness, what do we do? What do we do? We have to dig and imagine that a new world is possible. And that it's not only possible, but that we can be part of bringing it into reality. And I have been thinking a lot about how to cultivate that sense of possibility when so much of what, the victories of 100 years are under attack. Not only our healthcare, but our social security system, the women's right to choose our own destiny and what we do with our bodies. And I've been reminded of a speech, I imagine some people here may have heard it. There's a civil rights activist whose name is Valerie Kaur. She's a lawyer, she's sick. So her family comes from India, many generations in the United States, and she tells a story in the speech about her grandfather who came in the early 1900s, was thrown in jail, so she says, I try to imagine the darkness of my grandfather's cell. And in the Sikh tradition, optimism is a driving force. So I imagine that in the darkness of that cell, my grandfather tried to cultivate a sense of optimism, of possibility. And she says, I think about my son, who's a brown boy in America, who will wear a turban at some point, if he chooses to do so, and who might be perceived because of his religion as a terrorist. and who might be treated as other in his own land. So I, as a mom, have to think about how do I create a sense of possibility for my son. And she says, what if this moment, what if this darkness is not the darkness of the tomb, but the darkness of the womb? What if we are in a moment of great transition, all going through the pain of giving birth to a new country that has yet to emerge, a country that is one where we can all live with freedom and dignity. So she says, what does the midwife say when we are in labor? She says, breathe. Breathe first, and then push. Because if we don't push, we die. If we don't push, America dies. And if we push, we bring into existence the country that we want for our children and our grandchildren. And that's fundamental. That is fundamental. What Rights and Democracy is doing every day, that is fundamentally what the members of Rights and Democracy have made possible by traveling to DC with us again and again and again to not only fight and push to hold what's dear to us, but push so that we can create a new political reality in this country. And that's what the Be a Hero Tour is fundamentally about. It's about really calling ourselves into our moral center and saying this is the time we have. We have each other and we have this moment. And in this moment, let's breathe and let's push together. And my comrade, my beautiful comrade here, Ady Barkan, has put his life experience and his energy and his body in service of this vision of pushing for the America that we all deserve. And it is such a pleasure to introduce him here today.
Thank you so much, Anna. Listening to Anna Maria is always a full-body experience. So let's all take a moment to breathe. And center ourselves right here in this place, in this moment of time. I am enamored and inspired by the beauty of the roads and the forest and the mountains as we've spent the past 2 days driving through your green state and seeing your beautiful small towns. I was born in New England, but have since I spent most of my life in New York and California, and coming into this town of 11,000 souls is a rejuvenating experience, not least of which because at the food co-op checkout line, they're selling socialist magazines. I had the great privilege of sharing a stage a couple nights ago with Alexandra Ocasio-Cortez in Vermont. And I told her while we were on stage and told the crowd that for much of my adult life I've considered myself democratic socialist, but I've never declared so publicly, and I've never paid my dues. So I handed her a check for annual membership from my wife, Rachel, who's standing right there, and myself. And that's one of the actions that Anna and Tracy and I have been urging people to take as we've been traveling across the country this summer, is to invest your time and your treasure into organizations, into institutions that last longer than one election cycle, that have a strategy based on core values that aim towards a North Star, that are able to rack up incremental short-term victories while building towards larger transformational ones. And our politics in America is so candidate-driven, so election-driven, and elections most certainly have tremendous consequence, and people most certainly matter, but our deficit on the left has been that for too long we have failed to build institutions and infrastructure, and so that's why it really is a great pleasure for us and for me to be here with Rights and Democracy, which is doing all of those things. So if you haven't gotten involved, if you haven't donated, I'm urging you to do so now. And I'm grateful to James and all of the Rights and Democracy members and staff for their tireless work. So, with that preliminary matter out of the way, my name is Ady Barkan. I'm 34 years old, and 2 years ago, my wife Rachel and I were living really the luckiest and happiest life of anyone we knew. And we said so regularly. Every evening we went to bed filled with gratitude for our jobs and our home and our newborn, beautiful, healthy son who's now walking down the aisle and making eyes at all of you. And then in October of 2016, like a thunderbolt from the sky, I was diagnosed with ALS, Lou Gehrig's disease, and over the past 22 months, I have become increasingly paralyzed, and my voice, which used to move way too fast and way too loud, now is becoming harder and harder to understand. I was joking, although I wasn't joking. I was saying this morning that I've been giving speeches my entire life. When I was college age, at the dinner table, I told everyone what I thought and why they were wrong. And I was right. And in high school, on the speech and debate team, I did the same thing, and in law school, and afterwards. And yet this weekend in Vermont and New Hampshire and Maine, probably some of the final experiences. I can't even say the final speeches of my life because my voice is getting weaker and weaker every month. And so, faced with this short timeline, I am trying to figure out what message to deliver to the American people. And over this past month, we've been stopping in places like Des Moines, Iowa, and Minneapolis, and Detroit, and suburban Chicago, and upstate New York, in rooms like this, and small conference rooms, and having conversations with people just like you. And as Tracy said, whether they are white farmers or young black men, whether they are immigrant workers or retirees, so many of the people we meet are in search of that same freedom, that freedom to thrive that Anna spoke about. Not only the housing and the bread to feed their family, but also the roses to enjoy and the leisure time to build relationships with our family and our friends. And the question is, faced with the attacks from the Trump administration and Congress, what business do we have talking about the new world that we want to see? We have found ourselves last year and this year simultaneously waging a defensive war to protect any shred of social safety net and democratic rules of governance. And at the same time, we've seen rejuvenation of hope and possibility. My personal experience, like that of so many of you in this room, is an example of why we build a social safety net, why we have a healthcare system, and why we need a much better one to protect us from the slings and arrows of outrageous misfortune. Because Rachel and I were precisely the healthy young people who don't think they need insurance. Precisely the people who are now being removed from our health insurance system and leading to higher costs and worse coverage for everyone else. Many of us, myself included, thought that we had fought the battle for health care in 2008 and 9 and 10, and that we had largely won it. The ACA, though flawed, was the law of the land and would be implemented and strengthened over time, and we can move on past our battles for health care and towards other pastimes, whether those be, as we said, recreation, or whether it be fights for good jobs and a healthy planet, or many other battles that we have yet to win. And that is why you in Vermont and your junior senator are so important to our national politics. Thank you. The feeling is mutual. Because in this dark moment, while we battle the forces of hatred and racism and greed, we also are in the presence of leaders who are willing to articulate an alternative vision, willing to articulate their dreams and hopes of our movement. Bernie Sanders is not an exceptional politician because of his life story or because of his 2 tremendous charisma or because of his knowledge of esoteric procedure or politics or his ability to build a machine and distribute goodies? No. Bernie Sanders is an exceptional and singular politician in America because he understands his role as the voice and the vehicle for others. He understands that democracy, ruled by the people, requires representatives who are willing to listen and willing to use their platform to advance the agenda of their constituents. And he knows who he is accountable to. It is not PAC and not the donors, not the lobbyists, but the people in this room right here. And that, unfortunately, makes him very, very special. But, happily, he is increasingly being joined by other elected officials who are moved by his example, who frankly see the political wisdom and the benefit that he derives from his approach to people-powered politics, and by establishing brave benchmarks and goalposts in his policy, he is moving the entire national debate every month. Instead of talking about the ACA or even a public option, the Democratic Party is now almost entirely behind a single-payer Medicare law. And neither Bernie nor we intend to stop there. We're going to be fighting for a guaranteed good jobs for all that ensures everyone can work with dignity and produce and serve the public interest. We're going to decriminalize marijuana and end the drug war. We're going to move to a carbon-neutral economy. We're going to finally establish a sane and humane immigration system. And we're going to be clear-eyed and honest about the racial inequalities in this country, and we're going to say that our budgets, from the local to the state to the federal, should no longer focus on locking people up and policing them into submission. too many of our representatives from Jeff Flake on down refuse to be the heroes we need. And that means we're asking people to tell your stories, to put yourselves into conversation with your neighbors and your coworkers and your family members and your friends about what government can and should do, how we can and should structure our society, what a new social contract might look like. These midterm elections are going to determine so much for our country's future. Over the past 2 years, Donald Trump has rained down his greed and racism on the people of America, and now he's coming to us and seeking approval for his behavior. That's what these midterms are about. And this is our opportunity to stand up to him and to reject his politics and to lay the groundwork by winning back the House for impeaching the son of a bitch. Back to the election of 2000. If you could have your time back in September and October of 2000, how would you spend your time? How different could we make the world if we had those weeks back? Think back to the fall of 2016 and how different the world would look today if we defeated Donald Trump in that election. And think for a moment, allow yourself to dream for a moment about what the next 2 elections might bring us, and where we might be in January of 2021, with a Congress governed by a party that believes in Alexander Ocasio's vision rather than Paul Ryan's. And with a president who believes that her or his responsibility is to the people of America, not to the money in America. Think about how different how different a world we could be living in 2 short elections from now, and know that the future of our country depends on the choices that people like you make over these coming weeks and months and years. The future in our democracy is most certainly dependent on how we choose to spend our time, our limited, precious time. We are in now, in this moment, and the question is, how do you want to spend your time? I feel fiercely the urgency of now. And I know not only that that our democracy remains responsive enough that if we rise up, we can reclaim and rebuild it. But I also know that our own individual freedom and liberation can be achieved only through collective struggle. It is by being part of a larger movement, by being in relationship with our community, that we can achieve the salvation that we seek, that we can achieve the purpose that is greater than ourselves, and regardless of the outcome of these elections, it is by struggling and fighting that we can ensure ourselves a peace of mind. That years from now, looking back on this moment, we can know we did all we could. We laid ourselves out on the line in pursuit of that more hopeful and dignified world. Bernie Sanders has been putting himself into that fight for decades. Tracy and Anna Maria and the folks at Rights and Democracy and I are proud to be in that fight with him and with you. And it is my great honor to introduce the junior senator from this great state, Bernie Sanders.
All for coming out of this cool afternoon. Let me thank the Center for Popular Democracy Action. Let me thank Rights and Democracy for continuing to do such great grassroots organizing in Vermont. Let me thank Sarah Blondeville and the Vermont Coalition for Disability Rights, but mostly let me thank a true American hero, Ady Barkan, for all this. Now, Ady has kind of given my speech. I'll try to fill in a few of the details. And I think the first point that has to be made, and it has to be made loudly and clearly, that Ady believes, that you believe, and I believe, that the time is long overdue, where the United States will not continue to be the only major country on earth not to guarantee health care to all people as a right. That's kind of what we're here to discuss today, but before we do that, I want to pick up on Ady's point and tell you what all of you already know, is that everything is connected to everything else. And in the last several years, what some of us have been trying to do is to wage a political revolution in this country which transforms not only the politics of America, but the economics as well. And the good news is that despite obstacles and enormous opposition along the way, we are making enormous progress, and in fact, the political revolution is sweeping across this country. Ideas that we have talked about for years, and I think many people in Vermont have heard me talk about for years. Others have been talking about it all over the country. Ideas which a few years ago seemed to be fringe ideas or extremist ideas or unpopular ideas are now ideas firmly rooted in the mainstream of American political dialogue. A few years ago, some of us said, you know, American democracy is what we do in Vermont every March at town meetings, where people come together and one person has one vote. American democracy is not billionaires like the Koch brothers and others buying elections. And all over this country, interestingly enough, whether you're Democrat, Republican, Independent, Progressive, Conservative, people understand that we cannot continue to have a corrupt campaign finance system that allows billionaires to buy elections. Together we are going to overturn Citizens United. And all across this country, again, regardless of one's political views, people understand that the grotesque level of income and wealth inequality that exists in this country is not only immoral, it is just very bad economics. We cannot continue to have a situation where 3 people in this country, 1, 2, 3 people, own more wealth than the bottom half of America. We cannot continue a situation where one guy, the wealthiest person on earth, sees his wealth increase by $275 million every single day. And that same person, Mr. Bezos of Amazon, pays many of his workers wages that are so low that you are forced to subsidize them when they go on food stamps and Medicaid and subsidized housing. And all across this country, people are saying to the owners of Walmarts, to the owners of Amazon and McDonald's and Burger King, pay your wages, pay your workers a livable wage, $15 an hour. That idea of $15 an hour seemed to be just an extreme idea. But I want all of you to know that all across this country, states and communities are passing legislation for $15 an hour. The Vermont state legislature passed it, and we need a governor who's going to sign that bill. Talk about the major issues facing our country, more and more people and more mayors and local officials and governors all across this country understand that it is unfair to working families, unfair to the future of our country, when hundreds of thousands of young people cannot afford to go to college because their incomes are too low, or others leave school $50,000, $100,000, $200,000 in debt. And the idea, which a few years ago seemed to be a radical idea, unacceptable idea, of making public colleges and universities tuition free, is now an idea being talked about all over this country. People understand that instead of having Trump and his Republican friends give huge tax breaks to the wealthiest people in this country and to the largest corporations, such that 83% of all of the tax breaks in the Republican bill go go to the top 1%, people understand that is exactly the opposite of what we should be doing amidst so much wealth and income inequality in America today. Our job is to demand that the millionaires, the billionaires, and large private corporations start paying their fair share of taxes. All of which brings me to the issue we are here today to discuss, and that is the healthcare crisis in America. In the United States of America, we should not have 30 million people who have zero health insurance, and that number is growing. We should not be having even more than 30 million who are underinsured with co-payments and deductibles that will often keep them from going into the doctor's office because they just cannot afford to pay those co-payments or deductibles. We are losing in this country many thousands of people every single year who do not go to the doctor when they should because they either have no health insurance or they can't afford the co-payments or the deductibles that they have to pay. We should not be living in a nation today where we have the insane situation of 1 out of 5 Americans who receive a prescription from their doctor not being able to fill that prescription because they cannot afford the outrageously high prices of prescription drugs in America today. We should not be living in a nation where if you are wealthy, your life expectancy will exceed people who are poor by 10, 15, or 20 years. The length of our life should not be dependent upon our incomes. So we have two fundamental issues, I think, that motivate us when we talk about healthcare. First, of course, is the profound moral issue, which says that everybody in this country, whether you're rich, whether you're poor, whether you're black, whether you're white, whether you live in a rural community, live in an urban community, that if you live in America, you are entitled to health care because you are a human being. Again, this is not a radical idea. This concept of health care as a right and not a privilege exists in every other major country on earth. And all we are trying to do right now is say that if Canada and Germany and the UK and Scandinavia and every other major country on earth can provide health care to all people as a right, we're damn well sure that the United States of America can do the same. So the first issue is a moral issue. Health care for all is a moral right. But the second issue really is an economics issue. And that is to make it clear that we have the most wasteful, bureaucratic, dysfunctional, and expensive healthcare system on earth. And that not only from a moral perspective, but from an economic perspective, we cannot continue to spend the huge amounts of money that this dysfunctional healthcare system is gobbling up. There is no reason why in the United States we are spending almost twice as much per capita on healthcare as do the people of any other country. A recent OECD report came out. The United States spends $10,348, over $10,000 on every man, woman, and child in this country for healthcare. Canadians spend half of that, $4,800. British spend even less than that, $4,200. Now, why do we spend so much money on health care? And the answer is pretty simple. The function of our healthcare system is not to guarantee healthcare to all people in a cost-effective way. That should be the goal of a rational healthcare system. How do we provide healthcare to all of our people in a way that is cost-effective? But in the United States, what we have is a system motivated not by cost-effective health care, but by profiteering for the insurance companies and for the drug companies. And when you have the goal of making profits off of people's sickness, when your goal is not keeping people healthy or treating them in a cost-effective way, you end up spending almost twice as much per capita as any other country. Every American should understand that in 2017, the top 5 health insurance companies made $21 billion in profit. People should also understand, because this is the nature of this system, that the CEOs who run these insurance companies, who run these drug companies, make incredible compensation. The CEO of Regeneron, a fellow named Leonard Schleifer, received $95 million in compensation last year. The CEO of United Health Group received $83 million. The CEO of Aetna received $58 million. The top 5 drug companies in the world made over $50 billion in profit. And we have people in Vermont who cannot afford to go to the doctor, who cannot afford the prescription drugs they desperately need. The function of healthcare is not to make CEOs of insurance and drug companies much richer. It is to provide healthcare to all of our people. Understand this. Let me give you some really good news, but tell you what the good news is going to bring forth. Good news is that a few years ago, Medicare for All was seen to be, again, a radical idea outside of the mainstream. But as Ady mentioned, in the Senate and in the House, more and more people are coming on board. 3 years ago, I introduced Medicare for All in the United States Senate. And I had one really, really good senator on board. That was me. That was it. Last time I introduced the bill this year, we had 16 co-sponsors. And in the House, there are over 120 members of Congress on board Medicare. But more importantly, every single poll that comes out shows that a strong majority of the American people understand that Medicare is working well for seniors, and there's no reason why we should not expand it to cover all of our people. Last poll that I saw on this issue had 63% of the American people supporting a Medicare for All single-payer program. The news is that we are making enormous progress, but obviously these folks who make tens and tens of millions of dollars in salary, Wall Street, and the people who earn huge profits off of the healthcare system, they are not happy about the momentum for a Medicare for all. So what are we seeing? Just the other day, literally a couple of days ago, it was announced that there's going to be a new group of drug companies and insurance companies who are going to spend a god-awful amount of money trying to persuade the American people that Medicare for All is a bad idea. Last week, there was a study that came out from a Koch brothers funded organization called the Mercatus Center, talking about how much money Medicare for All will cost. And what they're trying to do there is to confuse the American people. So let me be as clear as I can be on this issue. Interestingly enough, this Koch brothers funded study itself was forced to acknowledge that a Medicare for all system over a 10-year period would save this country $2 trillion in healthcare expenses. And the reason for that, obviously, is we save billions of dollars on administrative costs, on advertising, on all of the bureaucracy that is now involved in a for-profit healthcare system. But what our opponents will do is they will say to the American people, you are going to be paying more in taxes. What they forget to tell the American people is that every person in this country is going to have comprehensive health care and not have to pay any more private insurance premiums, co-payments, or deductibles. That if you are the average family of 4 in America, let's just say you're self-employed, you are now paying on average $28,000 a year to private insurance companies. The good news is that under a Medicare for all single-payer system, you are going to be paying substantially less for your health care costs. And if you are an employer, you are no longer going to have to pay a significant amount of money for health care for your workers. You're not going to have to spend an enormous amount of time figuring out how you can get cost-effective health care. And if you are a worker in this country, the very good news is that you will now, under Medicare for All, no longer have to stay at a job you do not want to stay at, simply because that job provides you with decent health care. That's a big deal. The struggle for Medicare for all has nothing to do with health care. The struggle for Medicare for all has everything to do with the greed of the pharmaceutical industry and the insurance companies. They want more and more. They want to be able to continue to make billions and tens of billions of dollars in profits from human sickness. And our job right now is to stand up and say, no more. We're not going to see people in this country die because they can't afford health care. We're not going to continue to see people go bankrupt because they cannot afford health care. We're not going to see an incredible discrepancy in life expectancy because of the rich and the poor, because poor do not have access to decent health care. The time now, and this time is long overdue, for us to stand up proudly and declare that in Vermont and in every state in this country, health care is a human right. We are prepared to take on the insurance companies, the drug companies, Wall Street, and all of those institutions that profit from the current healthcare system. And we are going to succeed sooner than people believe in creating a Medicare for all healthcare system in this country. Thank you all.